Hello and welcome to Botanical Living with Kim. Today's video is going to be about health and specifically about using holistic options and how we compare those to Western medicine options. So we're going to talk a little bit about how we each perceive our own ailments and what we are willing to do and what changes are we actually willing to make in order to optimize our health. Hello and welcome back to Botanical Living with Kim. I'm Kim and I'm an herbalist, and today I really want to talk to you about health, and I'm curious how you perceive your own health, and that's really going to be the topic of today's discussion. I'm curious and I'm interested, and I'd like to help people make some educated choices when it comes to their own health. So I'm curious, are you the type of person that when you feel a physical symptom, do you immediately go to the doctor? And if you do immediately go see a physician, do you take what they say 100% at their word and do exactly what they recommend on that day? Or do you come back home, do a little research for yourself, and then try to make a more educated choice for yourself about how you would like your course of treatment to go? Or do you go on the other end of the spectrum and look from a holistic viewpoint and try to find out, is there anything within your own lifestyle and your own situation that you might be able to change in order to improve your health and eradicate that symptom? So that's really the topic that we're going to delve into today, and I hope this helps bring some insight into your lives and gives you some other options than just saying, oh, I have to take a pill because I was told to take a pill. Maybe there's a holistic option for you. It's just a basic fact. The older we get, the more likely we are to develop different health issues. Some of them may be minor, some of them may be really severe, and no two people are identical. And that kind of leads me into my first point, is that each of us are very individualized beings, and therefore our treatment options and our health should be treated in an individualized way. So there's not just a cookie cutter that says, oh, you have this symptom, well, you have to have this problem, and this is the only thing that's going to treat you. No, from a holistic standpoint, we would look at your issue personally and say, okay, what are the factors contributing to that particular issue? If you're dealing with something like chest pain, okay, are you actually dealing with a chest issue where you need medical attention and that's the only option for you? Or are there other contributing factors? Is it anxiety? Are you overly stressed? Are you eating a high protein, high salt diet that maybe is causing some of that constriction? These are the things you would look out from a holistic point of view. And it's something that I think is just really important to consider when you're making choices about what you're going to put into your body to help you. Now, I want to put out my disclaimer really quick right here. I am not a physician, I am an herbalist. And so all of the advice or suggestions that I make comes from a place of traditional uses of herbs, and then from other studies that I have researched over time. I'm not here to downplay a physician or the necessity of medical intervention at times. Thank goodness there are some wonderful physicians out there. There's some very, very high moral people that truly care about helping people get better. I have an uncle who's a physician. I highly respect him. Numerous family members and friends that are in the nursing field. They are wonderful people. They absolutely care about helping people get better. So I'm not bagging on the medical industry as a whole. I am just hoping to suggest to you some other options to think about and know that you're really in charge of your own body. And just because one person tells you that you have to take this medicine or you're not going to get better, and they have a certificate on their wall, doesn't mean they know everything. And sometimes you have to do a little bit of your own research and be in charge of your own body. And that's where holistic medicine really comes into play. Holistic health combines the mental, the physical, the emotional, all of the situational stuff that's going on in the world, in your body, and how it's going to impact you. So just because you have one ailment, it doesn't mean that you've got disease focusing on that. It could just mean there's an imbalance somewhere, and when you correct the imbalance, the root of the issue, that symptom goes away. And it's just something to think about. So let's talk now a little bit about pills versus a holistic viewpoint. And I'm not saying pills aren't sometimes necessary, but what you should know is there are always going to be side effects when you're taking a synthetic created drug. Now, so think about that. Let's say you go to the doctor and you are complaining about, I'm feeling really agitated, I feel like my head's pulsing, got all these symptoms. And so it sounds like, okay, high blood pressure. We'll go with high blood pressure right now. So absolutely, high blood pressure, super scary. Now the AMA just recently raised the numbers, so I would guess that the majority of the people within the United States are probably considered hypertensive now because of the numbers. They're constantly redoing the numbers, and those numbers are just a baseline. And within that baseline, every single person also has an individual range of normal, whether it's borderline hypertensive, low. I mean, my own personal blood pressure is typically about 110/70. That's always been considered on the lower end. So I know that if mine goes up to 128/80, which is still considered normal, I'm going to be feeling off. So you really have to know your baseline numbers and know what changes in your body. So with that being said, let's say you go into the doctor and they take your pressure when you first go in and your blood pressure is high. And so immediately that sends off this trigger like, oh my gosh, this person has high blood pressure or they're hypertensive. Let's get them on a medication right away. From a holistic standpoint, there's a few things to consider. Number one, did you go into the doctor feeling nervous? Chances are, if you went in to see a physician, there's already a problem happening. So you've already got a little bit of built-up anxiety and apprehension when you walk in the door. When that happens, your blood pressure naturally elevates. I'm sure you already know this, but I'm just going to reiterate this. Your blood pressure goes up when you start to feel any sort of anxiousness. That's its function in the body. That's what it's supposed to do. Now, it's not supposed to skyrocket and not come back down, but for the first 5 minutes or so, it's going to be elevated. So if you immediately go into a doctor's office and they take your blood pressure, especially with the automatic pressure pump, not with the handheld one, those are always higher anyway. Ask them to take it again towards the end of the visit, when your body and everything has had a chance to calm down, and compare those two numbers. Now, if you still have a high number, I would highly suggest, this is just my suggestion, but say, okay, I'm going to go home and I'm going to track it myself for the next 2 to 3 weeks. And you track it 3 or 4 times a day, at different times of the day. See what it's like in the morning when you wake up. See what it's like midday. See what it's like maybe after you eat. Check it before bed and track that. See if there's a pattern. If it's consistently higher at home as well, then you know you've got an issue. If it fluctuates, consider what could have been contributing to it during that time. If it's low at home, okay, you probably don't have an issue, and maybe you have white coat syndrome where you had all this anxiety going into your doctor's office in the first place, and that elevated your blood pressure. So if we immediately take that pill, now we're altering a whole bunch of stuff in our body, because pills always have a side effect. And again, sometimes we need a pill, but sometimes we don't. So let's say you don't really have it. You don't really have high blood pressure. You just have a nervousness, white coat syndrome when you're at the doctor's office, and you start taking a blood pressure medicine. It's going to drop your blood pressure, and then you're going to start feeling fatigued and tired and possibly get a headache and other things like that because now your blood pressure is too low. So then they might go, oh, well, we need to give you another pill to modify that. So this becomes a really vicious cycle. Sometimes medicine doses become increased when they really shouldn't be. And now there's this one symptom that you were trying to take care of right here. But now you've got this whole list of additional side effects that are happening now. So then you talk to your doctor about that, and they might say, oh, well, we don't change this, but we've got another drug that we can give you to help with this side effect. So now you're taking 2 drugs. And now this one's not working as well, so we up this dose, and I've got another side effect. Well, that's okay, because I got another drug for you. So now you've got 2 drugs over here and 1 here. And you see how this cycle just goes on and on and on, and it's really not good for your body. So my thought is, instead of immediately jumping to that pill, maybe take a little bit of time and view it from a holistic standpoint. Like I said, track your own blood pressure for the next 2 or 3 weeks, see where you're at home, and then also see what you can do. Can you cut certain things out of your diet? I mean, you don't get to certain points just overnight. We don't have high blood sugar and get type 2 diabetes overnight. We don't have metabolic syndrome overnight. We don't develop fatty livers overnight. We don't develop chronic ailments overnight. We don't suddenly have high blood pressure overnight. These things happen because of patterns in our life, behaviors we do, things we eat over time. So why do we think, why are we trained as a society to expect this allopathic, oh, they're just going to give me a pill at the doctor and that's going to make it all magically go away? No, it does not. All it does is treat that symptom. But if you don't find the root of the problem, you're forever treating the symptom. And I'm not sure why anybody would want to just be on a drug for their whole life when they could just make a few lifestyle changes and very likely not need that drug. Now again, I'm not saying people don't always need something. Sometimes it is necessary. And thank goodness there is Western medicine for those times when it's really important, especially for surgical intervention. However, on a day-to-day, I'm saying if you know that you just ate 4 hot dogs, or you know that you stopped at McDonald's and ate 2 burgers and a bunch of French fries and you drank a whole bunch of soda, well, that is not really a healthy lifestyle. And yes, it's super hard to change those things. I'll use my husband as an example really quick. A few years back, he found out he was pre-diabetic. And he didn't really give it a whole lot of thought. It was like, okay, yeah, I gotta be warned. I know it's a family history. I know this is a possibility for me. But he didn't really change much of what he was doing. Then one day, he ate a whole bunch of syrup and pancakes and took his blood sugar later, and it was really high. And it freaked him out because he was truly in a diabetic category. He went to the doctors. They did all the blood tests on him, did his A1C, all of this, and everything was really in a bad range. And they wanted to put him on a pharmaceutical drug that day. And they were stressing, it is so important, you have to take it this day. And he was freaking out because he did not want to take it. And he was completely determined to make a lifestyle change. So we came home, we discussed it. He decided to go ahead and buy into my herbal practice and listen to what I was saying. He changed the way he ate. He was willing to make this change. And a lot of people aren't willing to make this change. But if you're willing to do some things for yourself because you like living a more natural lifestyle, just consider these options. So he made this change. He cut out all refined sugar, cut out most of the carbs. And so it was really hard for him. For the first 3 weeks, he was grumpy and irritable and angry all the time and mad that I could eat this and he couldn't eat that. And he had to give up so much stuff. But we found replacements. So there's a lot of replacements for things. When you have to change your way of eating, it doesn't mean you never get to eat something you like again. It just means you're altering things. You're letting your body come back into a period of normalcy or homeostasis. And then sometimes you can even add some things back in, or your taste buds may change and you don't even crave that anymore. Or you might find something that tastes just as good as you remember the other thing tasting, but now you've got something to supplement for it. He cut out things like artificial sweeteners as well. People have a really big misconception that those zero products, like that have zero sugar, that they're so good for them. They are not. Aspartame is in most of those, and it is a horrible, horrible substitute because it causes so many problems. It will actually, it counteracts with the sodium. It'll spike your blood pressure. It won't do anything for your blood sugar, but it'll cause you to have anxiety. So if you're already suffering from anxiety issues or PTSD or depression, and you start adding zero products in, it's going to alter that chemical in your brain. That's what it does. You can do that research on your own. It's all over the internet, lots of information about it. Those are really scary products. He also started adding some more exercise in, just taking more walks, being a little bit more active, and all of a sudden, he started feeling better. Now we added in a regimen of herbs as well. There's a handful of herbs that are great for normalizing blood sugar levels. So he started doing that. And then herbs are also food. So when I cook, I'm very conscious of the ingredients that I'm putting in there. Certain vegetables help with lowering blood sugar. So we did all this. Next time he went back to his doctor's office, his doctor was shocked because he hadn't taken any pharmaceutical medication, but his numbers were in the normal. Now this didn't happen overnight, and I'm using blood sugar as an example with type 2 diabetes because you're kind of here and it drops a little bit, then you sort of platform, then you'll spike sometimes, and then it comes down. It's always this gradual down slope, but you have spikes and then down. And I'm going to do another entire video on blood sugar and specifically type 2 diabetes, where I get into more depth on sugar spikes and liver dumping and all those type of terms. But it took my husband about 8 months to get from 300 on his sugar down to about 102, which is right in the normal range. And it doesn't go up even hardly at all after he eats now. So he's truly in a non-diabetic, very normal range at this stage of life. So but he's willing to do that because he didn't want a synthetic drug in his body. So that's really what I'm presenting you with today. Thinking about it, making an educated choice for yourself. You are in charge of your body, and I know we all pretty much grew up thinking if I go to a doctor, they're the expert, they know everything. No, they're in practice. They are smart people, and they went to school, and they got a degree, and they're in practice. That's why it's called private practice. They're constantly practicing to perfect their craft. Just like I'm constantly in practice with my herbalism. There's always something new to learn. There's always additional ways to look at things, and we should be open to that. We should be open to that as practitioners, and you should be open to that on the receiving end, thinking maybe there's something better for me. Let me just do a little bit of research. Now, I'm not saying if you are bleeding profusely, say, no, let me stop and research why this blood's happening. No, get it taken care of. But overall, if there is a health issue that took a while to get to, it's going to take a little while to reverse it. But if you're willing to put in the work, you can reverse it and feel better. There's a few simple things you can do for yourself every single day for your own health. One of the things I like to do is, I'm going to probably promote drinking tea on almost every single video I ever make. But this is a cup of Tulsi and rose tea, and then I threw some fresh sprigs of Tulsi from my garden in it. This is a great anti-stress tea to take. So if you're feeling overly anxious or irritable, or you having high blood pressure, or anything that's making you feel tense or stressed, a cup of warm Tulsi tea like this is so soothing on your body. And there's studies that have been shown that it lowers blood sugar, lowers blood pressure, lowers your anxiety, all kinds of wonderful things. If you haven't done so already, please hit the subscribe button down below. Give me a like, thumbs up, and click on the bell, and you will be alerted every time I make a new video. As always, feel free to share it with your family or friends and on any of your social media. You can link it straight from here. And also, if you have any questions or positive comments, I would love to read them. Please put them down below. Again, I didn't make this video to bash Western medicine. I just wanted to empower you to look beyond and think there are other options for treatments out there, and let me consider it. Let me weigh the pros and cons of what should I do. And if you want to live a long, healthy life, you can put in a little extra work to be conscious of what you're putting into your body. You know, we're very willing to put a pill in there, but think of what's in that pill. Is it really healthy? How much of it's damaging organs on the way? Just things like that, good to think of. So anyway, I hope you have a great day, and I wish you health and happiness and a beautiful life. Take care. Bye-bye.